This is A&P Live Studio. I am your host. I teach A&P as a registered nurse and anatomy and physiology instructor for advanced level of healthcare pros. This video is for sheer education, not for any medical diagnoses or decision-making regarding your physical condition. Now, have you ever felt that sensation where the whole room just starts to spin? It's a really frightening feeling, and for a lot of people, it's caused by a surprisingly simple mechanical issue deep inside the inner ear. Today, we're going to explore benign paroxysmal positional vertigo, or BPPV for short. I want you to just imagine this for a second. Waking up and feeling like you've been thrown onto a wild, tilted Ferris wheel that's spinning way too fast. That's exactly how one patient, a woman named Wendy, described her first time experiencing vertigo. It's a terrifying, completely disorienting experience that we're going to unpack today. So let's put this into a clinical context. We have Wendy, our 68-year-old patient. She wakes up one morning and her entire world is just spinning uncontrollably. She's so dizzy she can't even walk, and she is absolutely terrified. She's thinking the worst, maybe it's a stroke. So the question we're going to answer is, what exactly is going on anatomically and physiologically to cause all this chaos? To really get what's going wrong here, we first have to understand how it's all supposed to work when it's going right. So let's start with the beautiful, intricate anatomy of our balance system. It's like our body's own internal gyroscope. Okay, so deep inside our inner ear, we have this structure called the vestibular labyrinth. You can see it highlighted here. It's made up of a few key parts: the utricle, the saccule, and these three semicircular canals. You can think of this tiny, fluid-filled system as mission control for our balance. It's constantly sending signals to our brain about where our head is in space.
Now, this is where it gets really interesting. Inside the utricle and saccule, we have something called otoconia. Just think of them as microscopic little rocks. They're tiny crystals of calcium carbonate. Their whole job is to respond to gravity and linear movement, like when you're going up and down in an elevator. When you tilt your head, these little crystals shift, and that movement stimulates tiny hair cells that tell your brain what's happening. They are the absolute key players in our story today.
So we've seen how it's supposed to work. Now let's look at the pathophysiology of BPPV. This is where those tiny helpful crystals turn into a pretty big problem. In a nice, healthy ear, the otoconia are anchored exactly where they're supposed to be, inside the utricle. They're just sitting there, sensing gravity, keeping everything in balance. All is well. But in BPPV, this is what goes wrong. For different reasons, maybe some minor head trauma, an infection, or sometimes just with age, a few of these otoconia can break free. And because of gravity, they often fall down into one of the semicircular canals. Most of the time, it's the posterior canal, just because it kind of sits at the lowest point. So now you've got these little crystals floating around where they absolutely do not belong. So how does this actually cause that spinning sensation? Well, when someone with BPV changes their head position, something as simple as rolling over in bed, those loose crystals get pulled by gravity. They start to tumble through the fluid in the canal, creating a current, a little wave that shouldn't be there. This wave pushes on the cilia, those tiny hair sensors, and causes them to send a powerful and totally false nerve signal to the brain. And that signal is screaming, "We are spinning, and we are spinning intensely." And this is the core of the problem, a massive sensory conflict. Your eyes are looking around and telling your brain, hey, we're just lying still in bed, everything is fine. But your inner ear, which has been hijacked by these rogue crystals, is sending a 5-alarm fire signal that you're in a blender. It's this huge disagreement between your senses that triggers that awful dizziness, nausea, and feeling of being off balance. So how can a clinician be sure this is what's happening? Well, it's actually pretty clever. They can use the very thing that causes the problem, the movement of those crystals, to get a definitive diagnosis. The test is called the Dix-Hallpike maneuver. What happens is the patient's head is moved into a very specific position that's designed to make those loose otoconia travel within that posterior canal. Now, this will bring on the vertigo for a moment, but it also produces a very crucial and specific clinical sign that the clinician is looking for. And that sign is called nystagmus. It's an involuntary, jerky movement of the eyes. This is a direct reflex. That false signal from the inner ear zips along the vestibulocochlear nerve, that's cranial nerve number 8, to the brainstem, which then triggers a reflex command to the muscles that control the eyes. When the clinician sees this very specific eye movement, it confirms the diagnosis of BPPV. Now for the great news. Because BPP is fundamentally a mechanical problem, it often has a very elegant mechanical solution. Usually, no pills or surgery are needed. The treatment is all about physically repositioning those crystals. The most common treatment is called the Epley maneuver. It's a series of specific sequential movements of the head. It actually starts in the very position that triggers the vertigo. And then, through a sequence of slow turns, it uses gravity to carefully guide the crystals out of that semicircular canal. The logic here is just simple and brilliant. The goal is to herd those dislodged otoconia out of the canal and back into the utricle, where they can just be reabsorbed by the body and stop causing trouble. It really is like carefully tilting a maze to guide a marble right back to the start. So, what are the wider implications of having this condition? Let's talk a little bit about potential complications and how BPPV really connects with other body systems. BPV is a perfect example of systems integration. The problem starts in the inner ear, but its effects just ripple outwards. The nervous system is directly hit with all that faulty signaling. Then the muscular and skeletal systems are put at risk because losing your balance so suddenly dramatically increases the chance of a fall, which can lead to fractures. And even the digestive system gets involved because that intense sensory confusion often triggers the vomiting center in the brain, which leads to severe nausea. And this is a really crucial point for our patients. While the condition itself is called benign because it's not life-threatening, the consequences of the symptoms, especially the risk of falling and getting seriously hurt, are very, very real and have to be managed carefully. So, let's just tie this all together. It all starts with the normal function, otoconia in the utricle, sensing gravity. The problem, the pathophysiology, happens when those crystals get dislodged and wander into the semicircular canals. This leads to the key clinical sign, vertigo and nystagmus when the head changes position. And the treatment logic is just beautifully simple. Use specific maneuvers to guide those crystals with gravity right back where they belong. You know, it really makes you think. Our entire sense of stability, of being grounded in the world, can be so completely turned upside down by a few microscopic crystals that are just in the wrong place. What does that reveal about just how delicate and how complex the integration of all our sensory systems really is? Thank you for joining me. And just a reminder, this content was for educational purposes only.